happily married couple decided to have a baby after 10 years of marriage. After many disappointments over the last year, they've become desperate and have spoken to their family doctor, who suggested they see a fertility specialist. After scheduling an appointment with a fertility specialist, they discussed the option of in vitro fertilization, or IVF as it is sometimes called, and decided to try it. Merriam-Webster's online medical dictionary defines in vitro fertilization as fertilization of an egg in a lab dish or test tube. IVF was developed by Patrick C. Steptoe and Robert G. Edwards for infertility caused by damaged, blocked, or missing fallopian tubes in 1978. Under their care, the first test tube baby, as it was called back then, was born in Great Britain. This procedure was first used in the United States in 1981. According to Kay Eldon, author of the book In Vitro Fertilization, there are several steps to IVF. The first step is to stimulate the ovaries with hormones so that eggs mature. Having several eggs to mature at the same time is an important step because some of the eggs will not fertilize or develop properly. The second step is to harvest these mature eggs. The woman is given a local anesthesia and is asked to lay flat on a table. Using transvaginal ultrasounds, the specialist uses a hollow needle and aspirates the mature eggs. During the process that takes 10 to 15 minutes, the specialist usually collects 8 to 15 eggs. The next step is to fertilize these eggs. In standard IVF, this is done by putting the sperm and the eggs in a lab dish that contains a growth media and putting them in a incubator to combine naturally together. A specialist can tell if the egg has been fertilized within 24 hours. And in 72 hours, they can tell if it is growing and dividing properly. If it is growing and dividing properly, the next step is to transfer the embryo. This is usually 3 to 5 days after the fertilization process. The number of embryos transferred is dependent upon the quality of the eggs, the embryos, and the number that the doctor and the patient decided on. During the transfer process, the woman should feel no pain. She will lay flat on her back, and the doctor will use a speculum to expose her cervix. He will then pass a thin tube through her cervix into the uterus and squirt the sperm that's in a small amount of fluid into the uterus. The patient will then be required to lay flat on her back for the next 1 to 2 hours before she is released to go home. For the next 24 hours when she does go home, she will be asked to do light to bed rest activity. After the transfer process is done, the last step is to just sit back and wait. For some, this is the most difficult step because they're so anxious to know if they got pregnant or not. 2 weeks after the fertilization process, the patient will come into the doctor's office and have a special blood test drawn that tests for HCG, which is the pregnancy hormone. If that test is positive, approximately 5 weeks later, she will have an ultrasound, and usually if that ultrasound is positive, she can expect a viable pregnancy. This may sound like a good option for couples who are struggling to become pregnant, But before deciding to go through with in vitro fertilization, a couple should research fully everything that goes into it and what the success rates are. The Fertility Success Rate and Certification Act of 1992 helps to do this. It states that it was intended to provide the public with information concerning the effectiveness of infertility services and to assure the quality of such services by providing certifications to embryonic laboratories. The Act requires clinics to report pregnancy success rates to the CDC, the Center for Control of Disease and Prevention, annually. And the Act also mandated the CDC to create a voluntary model of certifications for embryonic laboratories for each state if they so choose to implement. No matter the success rate of a clinic, there is always a risk for failure. Look at this chart from the CDC that shows the success rate of fertility clinics overall from the year 2000 to 2006. The success rate really does not change more than 5% and it hangs right around 35%. This brings us to the next risk involved with IVF. IVFcost.net states the average cost in U.S. to have in vitro fertilization done is $10,000 to $15,000. Multiple attempts can bring the amount up to even $100,000. This should be considered when deciding to do in vitro fertilization. The American Pregnancy Association lists these other risks: ovary hyperstimulation syndrome, a slight risk for bleeding, infection, and damage to bowel, bladder, and blood vessels, and the risk for multiple births. Multiple births can occur when multiple eggs are implanted into the uterus. This is something that should be discussed before deciding IVF is your option. We've discussed the IVF process, research, risks, and costs, but we have not discussed the personal and private choice that IVF is. Only parents know how much emotional, psychological, physical, and financial strain they can handle to make their baby dreams come true. But it is nice to know that instead of 0% for these couples, there is at least a 35% chance that this dream can come true for them.